Hi, we're going to look at Chapter 5, the infectious process and environmental control. So let's take a look at what makes an illness communicable. So I'm sure you've heard of communicable illnesses. We're going to talk about three components that are required for an illness to be communicable. One, it's the pathogen, how it got there, susceptible host or individual, and also the method of transmission. So we're going to take a look into each of these. So again, there's the three, and controlling the infectious illness. So understanding how these three components interact to cause an illness to be communicable is essential for limiting their spread. So we want to, as teachers, help children to protect themselves from germs. So what can they do to limit the pathogens in their classroom? So we really have to think about how we can control. Of course, you can't control all different types of pathogens, but you definitely can eliminate a lot. So let's look at that. Teachers have an ethical and professional responsibility to protect the wellness of all children in a group setting. Okay, so with that said, obviously we're going to sanitize tables, wash hands before we eat to try to limit communicable illness from, coming into a child's body or into the classroom. So again, we just do the best we can to help control and have a clean environment for the children. So how are illnesses even transmitted? So pathogens, like we were talking, or organisms, for example, viruses, parasites, bacteria, those are examples, can be transmitted in several ways. They can either be airborne, through the air, right? For example, coughing, sneezing. They could be fecal oral, which means like from the, they get something on the hands and it goes into the mouth, especially if you're changing toddlers, infants. So you definitely want to wash your hands after that. Also, direct contact would be like through touch of something or another person. Indirect contact would be surfaces, maybe through animals or insects, something like that. What are some examples of illnesses that are transmitted via each of these methods? Can you think of like some illnesses that are maybe airborne, maybe through like coughing, sneezing? So think about those. I know in the book it provides a lot of different examples, but one of them could be influenza, right? So you can get, sick through somebody coughing. We even think of like, COVID-19. So again, those are airborne. Fecal oral would be like hepatitis A. It's a little bit, harder, but it definitely happens. Direct contact, what do you think? Direct, like touching something or someone. A lot of kids could get direct contact through like, pink eye, contacting something. Pink eye could also be airborne, but it also could be direct contact with your eye or with someone that has it, or touching something. Indirect contact would be more like, I don't know, probably like surfaces, like, touching animals or insects. Some indirect contact would be like ringworm, if you ever heard of that. So those are just some examples. The textbooks gives a little bit more examples. And then the stages of infectious illnesses describe what typically occurs during each stage. So as you know, incubation period time, right? That's the time between the exposure of the infection and the appearance of the first signs or symptoms of an illness. Okay. Let's see. Prodromal. That's the first non-specific sign of an infection. So this stage ends when the symptoms characteristic of a particular communicable illness begins to appear. So it's kind of like non-specific signs. We have acute is an illness or disease during which an individual is definitely sick and exhibits the symptoms. So that's an acute illness, okay? And convalescence, that is the stage of recovery from an illness or disease, okay? So those are typically the stages of an illness. Infection control measures. So again, ongoing teachers' observations is vital to help control the spread of maybe a child, infecting other children. So again, teachers observing children to see if they're sick helps. Policy should be put in place and address a variety of protective measures, such as exclusion guidelines. For example, if a child's sick, what do? Do they go in a room alone with, a supervised, aide or teacher? And were they called home to come get picked up? Is there a certain amount of days where they can come back with a doctor's note, etc.? And you want to make sure too to have cleaning procedures in place, diapering procedures, food preparation, and hand washing. These are all good licensing policies and also should be included in the handbook at all child care centers or preschool centers. Okay, so immunizations. All immunizations should be current and are required for children and teachers. So teachers also need to have their immunizations updated. For example, their TB shot, MMR, Tdap. So we need also, as teachers in a licensed facility, also to be have our immunizations updated. Also, they like you to have a flu shot, but that is optional. Infection control part 2 is environmental measures, so must be implemented and include. So for example, what happens if you handle like blood or vomit? Is there a universal infection control precautions for handling these types of fluids? And again, in your textbook, it does show what you should do in these instances and where you should throw those away. Also, environmental measures include practicing correct hand washing techniques. So we just want to make sure kids are really rubbing together their hands and washing their hands. And you've heard the birthday song, Happy Birthday. Sing that, 3 times. That helps get all the germs away. So again, that could help, but there is, a little song that goes with it you can listen to. And again, cleaning and disinfecting. So where you're eating your food, is the table disinfected? Again, the bathrooms, toys, etc. And a good thing to note is for toys, putting a very small amount of bleach and water, which does indicate it in the book how much, could be a good disinfecting for the toys. And then the best thing is to leave it outside in the sun. The sun is a natural disinfectant, kills germs too. So that's, good to know. And again, rearranging the room to minimize extended periods of close contact. So hopefully the room is a little bit spacious. You get a little not so close of contact if possible. Environmental measures also include maintaining comfortable room temperature, so making sure the room temperature is good, and really doing that fresh air and ventilation, so opening doors and windows, especially in the morning, is a good idea. Taking special precautions with sandboxes and pools and water tables. So most people have like this sandbox, making sure it's covered. Water tables, you drain the water and even disinfect the water table as well. Teaching children, teachers, and families about infectious illnesses and effective control measures is a good habit to have at your preschool center or your school site. So caring for those that are like mildly ill children. So is the illness highly contagious? You need to think about these questions. Will other children be placed at risk? Does the child feel well enough to participate? All of these questions are good questions to make sure that you know when to send a child home. If they're not participating, something's not right. They should be picked up. Does the child's illness place them at a greater risk for catching something else? And then can teachers meet the child's needs as well as those of the other children in attendance? So again, meeting all these factors and considering this when a child is ill is very important. Okay, so that ends our PowerPoint chapter 5.